Good afternoon, my respected teachers and my compatriots. My name is Thakur, a student of 3rd year B.sc nursing from Viswass School and College of Nursing. Today I am celebrating and participating on a week of breastfeeding 2K21 by presenting a poster theme-based Protect Breastfeeding, a Shared Responsibility. Breastfeeding is a feeding of a newborn, infant or young child directly from the human female breast with a breast milk. This process is known by lactation, not from any baby powder or any container. Before going to the breastfeeding process, I want to share some information regarding breast milk. Breast milk or mother milk, which is produced in the mammary glands that only present on the human female breast. Human female breast produce a mother's milk which contains several proteins, fat, carbohydrates and the variable minerals and vitamins, which is the primary source of nutrition. Breast milk also contains several factors that are helping to implications and protect the infant from the various infection and inflammation, while it's also developing in the immune system and called microbiome. Under the control of certain hormones like prolactin and oxytocin, mothers will produce milk directly from the breast, and just it is produced after the childbirth to feed the baby. The initial production of breast milk, referred as the colostrum, which is high in immunoglobulin IgA that coats the gastrointestinal tract. It has certain laxative effect like expelling meconiums and also to prevent to production of bilirubin. It will help the baby from the birth to that time when the baby's immune system not functioning properly by itself. Now I am going to share some process by where the mother can hold her baby with the other hand and hold the breast with the other hand. At the first step, put her fingers over the breast in a circular motion to stimulate the glands. In a second step, use her fingers to support the breast with the downward motions. In a third step, just put her thumbs above the areola and helping to shape the breast. In the last step, remind it to not keep her fingers nearer to the nipple for squeezing. Let's talk about how to help the baby to latching out. At first, express a little milk onto her nipple. Touch the baby's lip with her nipple. Wait until the baby's mouth is opening the wide and the tongue is down and forward. Move the baby quickly onto her breast and aiming the nipple towards the baby's palate and his lower lip while applying correct breastfeeding position. It is ensured that your baby is latches out good and take or receive adequate amount of breast milk. Let's see the positions. The cradle hold is the most common breastfeeding position. The mom's arms support the babies at the breast and the baby's head is cradled here. Her elbow and her arm support the infant along the baby and the neck. The mother and the baby should be chest to chest. The sideline position, the baby lies next to the mother and their bodies are facing. If a pillow under your arm is uncomfortable, try to placing your baby in a crook of your arms. This position also keeps the baby's head at a good angle to bring the baby and breast together, with the baby's head and the higher than his or her tummy, which can be helpful to babies who are more likely to spit up. In a football position, the baby's head is supported by the hand on the same side as the breast to be used for the feeding. The baby's body is supported on the pillow and tucked under the arms, the same side as the baby to be used for the feeding. In a saddle position, the baby sides are tied to leg on the same side as the baby to use her feeding. Feed the baby in a supported position on the head to same side as the breast to be used for the feeding. Mother supports breast with the hands. A cradle or the cross cradle holds the help to premise the newborn or the babies with the trouble latching on. In position, gravity will help the baby keep their position securely on the body. Now I am sharing the extreme needed and important points of the breastfeeding, its advantages, both the baby and the mothers. Just to name a few of provides your baby with a perfect balance of nutrition, it's easy to against and rarely causes the allergies, and the baby is less likely to have stomach problems. In addition to these short-term benefits, there are long-term benefits as well. The breastfeeding baby have the less ear infection and the respiratory disease during the first year of life and the lower chances of developing obesity, certain cancers, diabetes later in the life. And it's also not forget that it's free, convenient and ready to demand. The women who are nurse their babies are returned to their position pre-pregnant size for the quickly and have the benefits later in life. Risk of getting ovarian cancer and the breast cancer, both will be decreases. The baby can get higher intelligence into the last years. One of the most important things to remember, when you are learning to nurse your baby, it doesn't mean that the breastfeeding comes naturally. There are certain situations and there are certain disadvantages of breastfeeding, and here are some reasons why women doesn't choose for breastfeeding. You have a less freedom. When you breastfeed, you are always on a call. You and your breast need to be available for the every feeding day and night. It can be exhausting, especially during the few weeks. You have to deal with some of the uncomfortable and even painful problems common with the breastfeeding. This includes like mastitis and the sore nipples. Not every baby latches immediately or the breastfeed well. Breastfeeding might be harder than you think, and you may end up with the feelings disappointed or distressed. Every coins have two sides, but as an originator, you should think about first life. As a parents, you have to give support to each other. There are certain places in our country who are still believe in this dark thinking that the first discharge of breast milk have to discard it. While the right thing, it's opposite. Mother should continue her breastfeeding up to 6 months. If needed, she can continue. So stop supplements and give proper nutrition. As a student nurse, I'm not just presenting a poster right now, but it's a genuine request to all those people who are participating with me right now. We are in a very crucial situation in this pandemic, and the newborns are the most sensitive. The only way to protect them is by just exclusive breastfeeding. Thank you so much.